related to some basic Google searches and spelling checks and presentation supports. बट वी नीड टू सी कि कोई भी टूल हमारे खेलने के लिए या हमारी लाइफ को इम्पोर्टेंट और लाइफ को स्मूदन आउट करने के लिए, देन इट हैज़ अ मीनिंग. So, I mean, now what we're going to talk about is that, like, why healthcare is probably embracing, globally the AI. In fact, the data suggests that, like, US healthcare is almost 5 trillion in economy, and जो Amazon का total revenue है वो 600 billion है. So if every company like Amazon, Microsoft is looking even at 10%, they can double their revenue, and that's why every big company is looking at healthcare, AI in healthcare. And now the reality is that we're facing so many more patients, more paperwork from insurance, from documentation, NABH. तो इसमें हम 2 या 3 टूल जो है at the end of the day I would want you to take home and use that so that you can make your life a little easy. And I'm not going to talk about any technical jargon, but ये slide सबने देखी होगी कि AI is going to replace the doctor. It is never going to replace a doctor. One thing one could be pretty sure, because AI में जैसे अगर स्कारलेट फीवर है उसका sandpaper feel, no other AI can find that the feel is sandpaper or it is kind of a smooth feel. So AI is never going to replace the doctors, but unfortunately the doctors who do not embrace AI, they are going to be replaced for the ones which probably would take AI a little early. Now we come to हमारे जो पेशेंट्स और जो इसमें जो अभी हमारे जो पेशेंट और डॉक्टर इंटरेक्शन है उसके अंदर हमारे रियलिटी और एक्सपेक्टेशंस में कहाँ पे फ़र्क है. सो तो सबसे पहले होता है कि लाइक यू हैव ऑलमोस्ट एवरी पेशेंट एक्सपेक्ट्स कि कोई भी नया गाइडलाइन आया, कोई भी नया स्टडी आया, द डॉक्टर मस्ट नो इट बिकॉज इट एक्सपेक्टेड ही इज़ द मोस्ट लर्नड member of the society, so he is expected to know every new study. But the reality is that, like, in 2024 alone there were 1.5 million scientific articles, so which means that, like, even Aladdin's jinn cannot read that many papers in a day. So it is impossible for us to keep, and even if I divide it specialty wise, I am expected to learn know in my specialty itself, I expected to know something like 20 to 30,000 papers, which is impossible for me to know in 1 year. Okay, so the other expectations is कि हम when the patient comes कि the eye contact should be maximized. The patient wants कि मैं बचपन की एक स्टोरी लेके आया था, एक रिपोर्ट लेके आया था, 2 साल पुरानी भी रिपोर्ट आया था, that all you should see. Then you do a complete examination not to miss anything on anything. Then also explain why the tests have been given and what is the disease, what is the prognosis. And the story doesn't end there. It also he expects us to give a preventive health care कि आप डाइट प्लान भी एक बार बता दो कि खाना क्या है, रहना क्या है, and then also expects us to follow up. जब व्हाट्सएप पे वो मैसेज डालेगा तो फिर उसके बाद what is the things that we expected to do. So this is something where I'm just saying, because this takes time, somewhere between 15 to 30 minutes is the time which is required for doing all this if you have to do it legibly. And there is some data to suggest that it takes approximately 21 minutes to satisfy one patient in an OPD, where, like, when it comes to explaining everything. Now 20 minutes is a luxury in Indian scenarios because, like, we do not really charge that kind of a US healthcare kind of a budgets or fees from the patient. So we have to look at the quantities. Now, having said that, we just need to see, we'll be talking about 4 different tools होते हैं, जिसमें से 2 के बारे में ज़्यादा बात करेंगे, 2 के बारे में ज़्यादा बात मतलब थोड़ा सा बात करेंगे, जिसमें से एक ChatGPT is everybody knows. Now ChatGPT is like एक फ्रेंडली नेबरहुड में एक आदमी होता था जो एक स्टोरी टेलर होता था. He is like, you have to understand, ChatGPT is a creative writer and it can talk, it can write anything from a poem for your children. It can write it can write a poem for your children. It can write यार एक मिनट बस छोड़ दे हाँ छोड़ दो इसको छोड़ चले जाओ बेटा leave. So sorry about that. So then Perplexity is like a smart research librarian. Perplexity is एक वो नेबरहुड का जो अंकल जिसके पास सारी नई किताबें होती थी और उससे पूछ लो कि कहाँ पे होगा, वो बता देगा कि इस जगह पे ये रेफरेंस है, ये रेफरेंस है. वो आपको सिंथेसाइज करके भी देगा, बट वो कहेगा कि आपको पता करना है, आपको पढ़ना है. ये मैं आपको बहुत ज़्यादा सिंप्लीफाई नहीं कर सकता है. क्लॉड इज लाइक अनदर पीएचडी स्टूडेंट जो हमारे मोहल्ले में होता था, जो एक डीप एनालिसिस करता था, एक रिपोर्ट को पूरी तरह पढ़ता था और रिपोर्ट को पढ़ने के बाद उसका एनालिसिस करके उसको एक एकेडमिक राइटिंग पेपर में देता था. एंड जेमिनी इज लाइक नेबरहुड आंटी हु नोज एवरीथिंग. She's like, she knows everything because it's integrated with Google. So every single tool that we are talking about has a distinct feature. Okay, so it is important for our understanding, because अगर हमें पता होगा कि हम किस चीज़ के लिए क्या यूज़ करेंगे, तो it will help us decide what is the best tool for us to do. Say for example, if I have to search for some guidelines, so as you said, we go to a library. So that is why Perplexity would be a better option in that case. But if I have to ask, a file to be analyzed, patient file to be analyzed, for example, Claude would be a better option in that case. And if I have like a ChatGPT, for example, would work if I have to draft something for the patients, because it's a creative writer from that angle. So जब हम इन चीज़ों को समझते हैं, we also must understand कि ये जो है, these are language models, these are accumulation of a knowledge, but there is a problem with all of these tools that they can hallucinate in the sense कि जब आप वो शुरू करते हो, उससे कुछ पूछो तो ज़्यादातर आंसर तो ठीक देगा, बट कुछ अपनी भी बना के भेज देगा. तो उसमें से सबसे ज़्यादा ये करने की जो टेंडेंसी है वो चैट जीपीटी की होती है, अबाउट हेलुसिनेटिंग. So because it cannot, so you need to always you should always validate it into a Perplexity, because जब आप Perplexity से देखोगे, अगर उसमें वैलिडेट करने से आपको लगता है कि ये लाइब्रेरी में भी हमने चेक किया और यही लिखा है, so then you are arriving at the right kind of an information. So these large language models are kind of tools, बट इससे आपको बात करनी है, और बात करने के लिए आपको इसमें एक क्वेश्चन पूछना है. अगर आप ढंग से क्वेश्चन पूछोगे तो ढंग से आंसर मिलेगा. सो वी नीड टू सी, दिस इज कॉल्ड ए गीगो इफेक्ट, गार्बेज इन एंड गार्बेज आउट. सो अगर आपको एक प्रिस्क्रिप्शन ढंग से लिखी होगी तो आपको सारा समझ ईजी आ जाएगा. और जबकि अगर आपको so you have to take it also as a first year resident. Suppose you have a first year resident coming to you and you say, you go to the library and get some articles on Kawasaki disease. So he'll get a huge data which is so much that you may not be able to pick it up, and you may even get something which is of no relevance to you. On the other hand, if you tell the same resident, go to the library, pick up a Kawasaki disease articles which have been published in last 2 years and have been indexed in PubMed with an impact factor of more than 1.5, then he will get only specific those two, so you get the relevant answer. So what I mean to say is that the way you tell the ChatGPT would or others, you would probably get an answer. तो इसका फॉर्मूला जो होता है कॉन्टेक्स्ट, टास्क और फॉर्मेट. सो कॉन्टेक्स्ट, जैसे हम मेडिकल साइंस में क्या कहते हैं कि भाई सेटिंग में है. सो आई से ओके, दिस इज अ पेशेंट हु इज एक्स. कॉन्टेक्स्ट इज अ पेशेंट 80-year-old male child, a male person with diabetes with this thing XYZ. That's the context that I say. I give him a task ki, okay, for this patient draft a diet plan. So that is a task. And format, I say I want it in PPT bullet form or a patient friendly note, or I want it in Hindi. So if we say these three things, context, task and format is good enough for us to remember. There are other features, but let's broadly look at simplifying कि इन 3 चीज़ों में अगर हम बोलेंगे तो ज़्यादातर बच्चे जो होते हैं ज़्यादातर LLM मॉडल समझ पाते हैं. अब मैं एग्जांपल आपको दे रहा हूँ कि जैसे अगर आप बोलोगे कि summarize neonatal sepsis, that's a very wrong, because it's going to give you a very huge kind of very vague kind of an answer. But if you say post 2022 evidence on neonatal sepsis in bullet points with references and keep it 300, so it will give you a very specific output that you can utilize for your this thing. So ज़्यादातर लोग जो डॉक्टर्स अभी यूज़ कर रहे हैं, मैं देख रहा हूँ कि वो कहते हैं कि वो they put a very broad kind of a prompt. Tell me about like neonatal jaundice or PH. So that doesn't really count. Now I'll come out first कि जो हम पहली प्रॉब्लम हम बोल रहे थे कि पेशेंट एक्सपेक्टेशन और इसकी, तो फिगरिंग आउट द रीसेंट डेटा फ्रॉम तो परप्लेक्सिटी में आपको करना है, बिकॉज यू हैव टू गो टू द लाइब्रेरी, बिकॉज यू लुकिंग एट सो आई विल जस्ट शो यू कि अभी इसमें you have to put it, what are the top 5 RCTs on diabetes published in the last 5 years. Okay, so so you go and you have, just for sake of this thing, I've already done this thing, so I put it here and I just go to this like perplexity का एक this is visible, no? Hello?
Yes, it is visible.
Yes,
Right.
yes, doctor.
Yes, yes.
Okay, so you just have to go like so यहाँ पे आप जाके इसमें आप डालते हो कि what are the top 5 recent RCTs published in this thing with reference and link, and I just put it here, and within a matter of 1 second it will scan, it is reading almost 10 papers and is giving me the answer. So it takes maybe 1 minute or 2 minutes depending upon what is this like is so इसमें अभी इसने दे दिया कि like flow trial और मतलब which was published in NEGM 2024. It is like ABCD, मतलब you could probably just see, but NEGM again or surmount trial, I don't even know about this, but I'm just like saying okay. So similarly when you need to see कि this, so जैसे मैंने डाला तो मैंने इसमें डाला तो it gave me these things which I pasted already, but I was just showing it there. So I can also say just tabulate it into a tabular form, so it gives me major findings, limitations and reference. So it like, so if you see this, यहाँ पे दो है जो एक deep एक research है which you get in a pro version of perplexity, and that you should use, because जो इंस्टा है वो ठीक है good, but academics के लिए you need to use this pro feature down at the bottom. If you see this, like, so that this one is probably going to give you the better results when it comes to search. So you have seen, so you have listed all that so you don't have to go anywhere. Within a matter of next 2 minutes you have actually looked at all that information that you wanted, but you had given a very kind of a thing. अब मैं ये तो आपके लिए किया था, बट मैं अपने हिसाब से एग्जाम्पल बता रहा हूँ कि वी हैड इन 2004 द फर्स्ट गाइडलाइंस फॉर neonatal jaundice, and now we in 2022 we had another revision of the AAP guidelines. Now as a doctor, I mean, I'm expected, neonatologist, I'm expected to know these guidelines by heart, but truly speaking, with a busy practice, with busy life and a personal life, there is no time for learning all this kind of jargon. So what I did was I put the same question into the perplexity, and I said like I'm just showing what are the latest guidelines for neonatal jaundice and compare the earlier and the latest guidelines. So what it did, in a matter of like 1 minute, it created the guideline. It gave me the whatever are the best features or the new features, and also compared. So you can use it to any kind of information that you're trying to look at a recent advances is concerned. So what it did was that I spent only 2 minutes or 5 minutes learning about a new guidelines or a new this thing, and I had a comparison. So it made my job much easier to remember what I was supposed to go through a 50-page document, and it would have taken me 2 or 3 weeks to actually complete that document. Now I'll also show you something extra. So you have here is called a notebook LM. Okay, so for those who have like this, so this is Google's free software where you can just download and create a new notebook and upload. And I'll show you, I've uploaded the same guidelines here and uploaded the हेयर गाइड. What is different about a notebook LM कि वो सिर्फ यहीं से लेता है. It does not hallucinate. It only takes references from this. Now I'll just show you कि अगर आप इसमें और क्या क्या कह सकते हो. एक तो you can talk to the guidelines. Say for example I want to say when should I stop phototherapy. ठीक है. So then I can talk to the PDF the way this like guidelines. Okay, this is okay, you should consider discontinuing when it is decreased by 2 milligram per deciliter. So it helps me understand this thing. I may say okay, like when should I start. Yeah. So this जो मेरे questions होते हैं, जो मेरे specific होते हैं, जो हम एक वेबिनार के बाद क्वेश्चन एंड आंसर करते हैं, वो हम डायरेक्टली इसके साथ कर सकते हैं, एंड इट हेल्प्स मी लर्न दिस. सेकेंड थिंग विच इज़ अनदर गुड फीचर ऑफ नोटबुक LM कि आप इसको कन्वर्ट कर देते हो इनटू एन ऑडियो. मैंने अभी करके रखा है ये ऑडियो ओवरव्यू जहाँ लिखा है. सो यू कन्वर्ट दिस गाइडलाइंस इनटू ए पॉडकास्ट फॉर्म, एंड आई जस्ट प्ले इट हियर. Okay, so I was just saying कि यहाँ पे, so this converts it into an audio, and I'll share a link of this afterwards. So you can convert this into an audio podcast. तो आप अपनी गाड़ी में भी चलते चलते ये आप घर से बाहर जा रहे हो, तो it can play like 2 people talking about neonatal jaundice as this thing from this document. So you can even take नई स्टडी आई है, उसमें 2 लोग बात कर रहे होंगे अबाउट ए सरमन ट्रायल. सो देन one male and one female, or one, you can change that, and you could probably listen to this kind of an information on the group. You can even create a video overview of this particular thing. तो वीडियो जैसे लाइक ये है, मैं अभी आपको दिखाता हूँ. ये मैंने इसका वीडियो ओवरव्यू बनाया था, तो which tells about कि okay, what is there the
If you're a new parent or you're about to be one, you have probably heard about newborn. Think of this as the playbook that medical teams all across the country use to make sure every single baby stays safe. The entire system, all the screening, all the monitoring, it's all designed to prevent one.
So what I was showing कि आप इसको guidelines को लेके, you can talk to that guideline, you can convert it into a podcast, it can convert into an audio video podcast, and that is for easy digestibility when you probably would want to review this kind of thing. Now what we also do is like कि जब इतने बड़े guidelines होते हैं, so how do you use it, like because इतना 25-30 पेज का guidelines है, so you can convert it into a 2-page clinical note using Claude. So I'll just इसमें दिखाता हूँ. ये है, अब ये Claude में मैंने इसमें डाला और उसको बोला कि आप ये ना इसका you summarize this into 2-page for the. So you say okay, make it into and it takes around 2 minutes, 1 minute to make it into a 2-page summary, which you can just go through and keep it as file, so that if you need to see visual assessment less than 24 hours if jaundice measure, so as a practical, you can also create a flow diagram for this, like from the Claude, and you can use it for your staff learning, your teaching learning, or your own documents that you could keep it, and it creates at least it only takes 2 or 3 minutes to create that document to help the child. So ये जो मैंने अभी दिखाया, तो ये आप ऐसे करो, तो एट द एंड ऑफ द डे आपने सब ये पढ़ लिया, बट आपको इससे फ़ायदा क्या होगा? सो उसके लिए आपको चैट जीपीटी में डालना है एंड मेक इट यूजेबल। से फॉर एग्जांपल आपने क्या कि आप पेशेंट आएगा मेरे पास, आई वांट टू प्रिपेयर ए 5 ड्राफ्ट 5 FAQ फॉर द पेरेंट बेस्ड ऑन द न्यू जॉन्डिस गाइडलाइंस। सो आई अपलोड द गाइडलाइंस एंड ऐसे कि 5 क्वेश्चन बना दे, तो इसने 1 मिनट के अंदर ये बना दिया कि वाई डू माई बेबीज डेवलप जॉन्डिस, हाउ बेबीज चले। सो दिस, and you can also ask ki, now you change it to Punjabi, you change it to Hindi, whichever language you want. It can change it for the patient. You can ask it to create an infographic. Images wise ये इतना अच्छा नहीं है, but it still can give you a good infographics in 2 minutes and say okay for the parents, so that you can keep it in your OPD, you can keep it anywhere that you feel like, at least for the parents to know what is there. वन ऑफ द अदर एडवांटेजेस ऑफ चैट जीपीटी इज कि जब हम स्टडीज करते हैं या पढ़ते हैं तो हमारे पबमेट में ऐसे वाला पूरा चैप्टर आता है कि वो एब्स्ट्रैक्ट के साथ कि बैकग्राउंड रेफरेंसेस. Now, even if the best of the people, like the academicians, find it difficult to read it this way because there is a lot of information there. So what you do is like you put it there, you copy this and put it into the chat GPT and you write it, simplify this for a third year resident. You want it even simplifier, you can say class 12 student. You can say, okay, I do not understand. You can use this jargon for any of these things. So you want to make it more complex, study it for a PhD student. So it would know that you are now asking it to do it for simplify. I cannot understand it. So it helps you understand. Now the same, this particular whole study has now shows that progression to type 2 diabetes on tirzepatide was like on like 90% lesser in if the dose was given, and in tirzepatide group after 17 weeks after treatment also only 13 points. So we can remember these 3 points when it comes to knowing, and you can also convert it into simple image. You can ask इसको make a visual diagram for it, वो ऐसे बना के आपको दे देगा, तो आपको अपने पास भी रखा है तो इसके बाद आपको भूलना और भी मुश्किल हो जाएगा, बिकॉज यू वुड हैव नो कि ओके सरमॉन ट्रायल से सस्टेन वेट लॉस at 12 to 20% and strong diabetes prevention with this thing, enough for you to use this medicine in a clinical scenario. Now you could use Google for making slides for the staff, so I'm not going to this. So how does one doctor should be doing कि आपको किसी भी संडे को, आपको नेक्स्ट संडे को आपको जाना है कि परप्लेक्सिटी में नई गाइडलाइंस अबाउट से प्री एक्लैम्सिया, like, or anything like, for example, about neurocystic psychosis. Now your guidelines, you find the guidelines, you क्लॉड को देके डाइजेस्ट करके छोटा करके आपका सिर्फ 30 to 35 minutes लगेगा. It is more shorter than the time you travel to go to a webinar to understand what is being talked about in the guidelines. And here you have, so you can make it and ask the chat GPT to make a smaller snippets. You can just make Gemini to make visual tools or slides, and easy for you to remember whatever was given. ये तो है academics का. उसके बाद आता है कि पेशेंट्स की रिपोर्ट्स जो आती है कि पेशेंट कहता है कि मेरी बातें सुनो, और मेरी बातें सुन के आप उसको लाइक कि पूरी स्टोरी सुनो, फिर मेरे सारे रिपोर्ट्स भी देखो, मेरी लैब भी देखो, मेरा 10 साल का रिकॉर्ड भी देखो. अब इतना, और मैं देने भी मैंने 400 रुपये ही हैं, बिकॉज इससे ज़्यादा मैं 500 रुपये से ज़्यादा फीस नहीं देता डॉक्टर को. सो विच इज़ इकोनॉमिकली नॉट वायबल. सो व्हाट डू यू डू? सो ऐसे केस में आप क्लॉड यूज़ करोगे, एंड आई विल शो यू बट अ वेरी लाइव एग्जाम्पल जो मैंने अभी यूज़ किया. तो इसमें आप उसको दे देते हो एंड ऐसे के. सो ये मैंने अभी एक पेशेंट है, किसी ने मुझे भेजा था, तो MRI रिपोर्ट, एंड दिस इज द होल टेक्स्ट दैट द पेशेंट. I do not know about this. Is a 50-year-old patient. I have no idea about an MRI of the spine. I have no idea about, like, they said ki, okay, image, patient summary, or yes, like. So then I just like went through, I said, go through this MRI images and reports and patient summaries, create a timeline of illness, highlight the abnormal reports because मुझे पता ही नहीं है कि होती क्या है, and mark the red flag signs. And if you see, now you see on the right side, so it took 2 minutes to make this, say, patient Shalini Rastagi, date of MRI, whatever, and this is the timeline of illness, and ये हुआ, उसके बाद red flag signs ये है, and this is what is happening. So it's given all that, this like recommendation, poor prognostic features, prognostic, everything is given, and it is given an urgent note also saying that what is happening to this. So when the patient is coming to your clinic, and if he comes with a plethora of files, like your assistant can actually put them into Claude and make a summary for you. If you do not have that much time also कि go through, ये बहुत बड़ा हो गया, I made it into a 5-pointers. Like, I said, make 5-point OPD summary for this. So he said chief complaints, clinical findings, and this, what is the final kind of a, management plan for this particular, patient that we need to do. So it has worked out. It still needs your input as a doctor to validate this. But before the patient has entered and spoken even one single word in your OPD, if the person outside can do it, you have reduced your consultation time, like of listening, going through the reports, going through everything by almost 100%. And by the time he reaches inside, okay, what is the diagnosis, what is the problem that the person is kind of going through. So for digesting bulky patient reports, Claude is better. And say, for example, it gives you this, and so, or you can even ask ChatGPT to summarize. It will almost give you the more or less the similar kind of a picture that the Mrs. Shalini Rastagi fell on 25th of December, and then it fell. Now, what is important is to, like, I did not know anything about this particular entity, what to do with the compression fracture of vertebra. So what I did was, like, I took this and I put it into perplexity. And as I said, according to the latest international guidelines, what should be the approach to the patient, surgical or conservative? Okay. So perplexity, as I said, is a library. It picks up and compares it to the next this thing. तो इसने निकाला कि भाई ये इसने सडनली 10 वो सोर्सेस पढ़े, फिर इसने निकाला कि ये सर. So I'm just showing you, like, see current these conservative management ABCD, whatever it says, and it, at the end of the day, it also gave me why the surgery is not indicated, absence of surgical criteria, no neurological compromise, no patient responding well to conservative measurements, and no persistent intractable pain. And has given me what is the recent evidence against routine vertebroplasty. एक टाइम पे सबका होता था जिसको spinal compression होता था, तो they would put a bone cement and vertebroplasty. This probably is not. Again, individual patient may have their own nuances that you need to see, but you now realize कि यही चीज जो मैंने की है, जिसको कुछ भी पता नहीं है इसके बारे में, यही चीज patient भी करके आएगा. And he's already read all this that you probably are going to teach him, and okay, कि absence of surgical criteria, कुछ भी नहीं, and gives it this thing. You can use Gemini to make growth timelines, but that's not important. Important is that you need to see, if you have a lot of reports, you ask your assistant to dump all the reports, get a timeline, convert into a short clinical story using a ChatGPT, and double check against the latest guidelines. Then you would probably get the best outcome for the patient. Now पेशेंट्स जब आते हैं, वो आपको उससे बोलते हैं कि भाई आपको आपने दवाई तो बता दी, बट आपको प्रिवेंटिव हेल्थ भी बताना था, आपने उसका वो बताया नहीं कि इसमें करना क्या है मुझे. ठीक है. सो आई वुड जस्ट से ओके, ये जो है, आई एम जस्ट क्रिएटिंग ए न्यू चैट, and I'm saying, okay, I am a pediatric dietitian, and I have to make a diet chart for 2-year-old child, Indian, vegetarian and does not eat egg. Give 10 gram protein and I mean like चलो इतना ही कर लेते हैं ठीक है. So it's like, so when I say I've just like put it context for the thing, so it just like so now see it's given me all that what it could be the breakfast, what could be the this thing. So you could probably just like make individualized plans for your own patients depending upon. So suppose there is a diabetic patient who needs this thing, you probably can make a diabetic. You may have somebody with like a chronic kidney disease, you could probably use it. And this is like, you can also make it into change the language to Hindi, Punjabi, write anything like so if you see in a minute, I don't know how to read a Punjabi, but I'm saying this is like, this is probably what it is done. So it took just 1 minute for it to, like, you can even name the patient, it can give any kind of a this thing. So you need to have this. So इसके लिए आपका बेस्ट चीज़ रहेगा कि आपको अगर आपको एडवाइस देनी है, आपको कुछ डाइट चार्ट बनाना है, तो चैट जीपीटी इज समथिंग दैट विल डू इट. But again, what I just said, like you do this, you should always compare. I said all these tools have a habit of hallucinating. So इसके लिए इसको perplexity में डालो और उसके साथ देखो कि this is like so what I did was like this, please validate it according to the guidelines which are international or diabetic association or whatever. I can prove National Institute of Nutrition, and it says कि okay बाकी ठीक है, but if you see your plan has more protein than the international standard, so I can look at this. So I know okay fiber इतना ज़्यादा भी होगा चल जाएगा. I mean, okay, it also says if it exceeds, it doesn't matter. So overall, it says it is validated, it is fine. You can go ahead with this, plan. You could use Claude for making larger guidelines, but you don't need to get into this. So essentially, you can use ChatGPT to convert smaller things into patient kind of advices which you can give. जब दूसरा प्रॉब्लम आता है कि डॉक्यूमेंटेशन का है. अब डॉक्यूमेंटेशन का हमारे यहाँ पे जो आईपीडी में जो लोग काम करते हैं उनमें एक होता है कि एक तो हमें ओपीडी के नोट्स लिखने होते हैं, एक एडमिशन नोट्स लिखने होते हैं हमें, लाइक एंड देन वी ऑल्सो आर सपोज टू मेक डिस्चार्ज नोट्स. सो दिस टेक्स अ लॉट ऑफ अवर टाइम इफ यू हैव टू काइंड ऑफ look at this. So I have to say, okay, now I'll say, just come to that. So ये अभी मैंने एग्जांपल दिया. ये कल एक पेशेंट था, एक उसका आया था यहाँ पे कि दिस इज द आउटसाइड रिपोर्ट. नाउ आई टुक दिस पिक्चर एंड अब नीचे देखो इस पे लिखा है कन्वर्ट दिस इनटू एडमिशन नोट फॉर दिस बेबी. Like so, and in a minute it gave me a complete, like saying okay, not only it gave me like a chief complaints history, it gave me a provisional diet just by looking at this image, which may be difficult for you to see. In a minute it gave me कि okay chest में ये है, S1 S2 ठीक है सब कुछ है, ये टेस्ट करा लेना, कुछ अपना भी बताया कुछ इसलिए, and then said कि ciprofloxacin has to be given 30 mg IV OD. Okay, so it took me 1 minute to say okay this is probably like this thing. Now I said then, like the next set, as I said, always validate it in this thing. So I put this plan into this. Is this admission note in line with the management of this baby according to the international guidelines? So surprisingly it came back and said कि okay this is fine, but you see it says कि you start CPAP because इस बच्चे को आपको अगर ऑक्सीजन से काम नहीं चलेगा, इट नीड्स टू बी गिवन एज नेजल CPAP. इट ऑल्सो पिक्ड अप कि अमीकासिन की डोज फॉर इज अंडर डोज्ड. So it said recommended modifications. So you can change to initiate a CPAP, correct the antibiotic dosage, warming measures, and all those things. So what it आई मीन टू से इसकी जो भी आपने लिखा है, सबके पास ये रेजिडेंट और एक स्मार्ट रेजिडेंट की लग्जरी नहीं है, बट आप ये नोट आपने अपना ही लिखा है और उसको डाल के, उसमें डाल के आपका जो असिस्टेंट है वो निकाल देगा। सो और निकाल के वो रेकमेंड भी कर देगा और चेक भी कर लेगा, तो यू नो कि दिस इज समथिंग। आफ्टर यू चेक्ड, you've sent it, made it into a picture and send it to your ward assistant, nurse or whatever, and says कि इसकी ये चीज़ें correct करो भाई, like because this is something that we need to correct because this is not appropriate for this baby. So again, this took just 1 minute to do this. Okay, now I'll also show you from an OPD. ओके, देखो ये ना, ये है so this is like I'm saying okay, this is a baby who's like यहाँ पे, and I'll say okay, this I just copy, this is like somebody showed me a snapshot of this and I put it into the like this thing. I said you chat like okay task. अभी मैं पूरा डिटेल प्रॉम्प्ट नहीं लिख रहा हूँ, बट लाइक दिस इज लाइक मेक डेली प्रोग्रेस notes in SOAP format for this patient. So I have just put this command and this is like came to me, and it said it does not even say okay, this is termed to like VIG MSL, like something PH, and I press it and then it says okay. See, it says baby of Shalu Pilpanjali Hospital, like subjective notes are baby taken off the respiratory support, maintaining well, like, and you would see okay, this note is done in a minute, in less than a minute, so that anything that you need to see, just need to copy this and paste it into your file. There is the workload is kind of decrease. You can probably also do like suppose ये खासकर डॉक्टर रितु के लिए, लाइक ये देखो अब इनका एक एक एक्सेल शीट बनाई है, उसमें सिर्फ डेटा रखा है कि मदर का क्या है। आई जस्ट से मेक डिस्चार्ज समरी फॉर मदर रजनी। Okay, so when I say okay, this is like it starts analyzing कि इसमें से it takes like Rajni है, so it like, so I have just put this and it takes another, and see like in a minute it says कि okay, this is like, so a discharge summary took just 1 minute when it came less than a minute for you to be prepared. So how much time you can use save, and same you can use it for nursing care. It's like, so it's tomorrow you say okay, it's advised on prescribe oral medication, like so, but you say okay, you want to give advent 625 twice a day BD for 5 days, and then or whatever it is, okay, this is like updated summary आ जाएगी कि it's like and if you see the amount of data that has been put into there, it's just the time of delivery and the date of delivery, and this is like, so you could say okay, this is all done in a matter of 2 or 3 minutes, that your discharge, your admission, your everything can reduce to like, and it's all legible. It is like the patient cannot complain कि आपकी डॉक्टर की मेडिसिन समझ नहीं आ रही, ठीक है। सो दिस इज वेयर लाइक डेली प्रोग्रेस नोट्स आ जाते हैं, लाइक ये है। सो डिस्चार्ज समरीज में मैंने आपको बता दिया कि ये पेशेंट का ना, जो लाइक मैंने एक वो बनाया था, तो ये है, ये पेशेंट का, ये मैंने हॉस्पिटल से निकाले थे। सो दीज आर द काइंड ऑफ NVD, दिस थिंग, दिस इज ऑल आई हैव पुट, hepatitis B, APGAR score, weight, and this thing, and it created all that summary that you wanted to like create. Now आता है कि OPD में like we have a child who comes to OPD, the patient who comes, and I'm just too tired to speak. Okay, so okay, so like तो अभी मैं it's like अभी तो आई पूछ दिस लाइक चैट जीपीटी में अभी भी ये देखो डॉक्टर मेरा 7 साल का बच्चा है उसको टाइफाइड डायग्नोज हुआ है और मैं 5 दिन से उसको एजिथ्रोमाइसिन दे रही हूँ बट अभी भी बुखार में कोई फ़र्क आ नहीं रहा है बुखार कभी ज़्यादा हो जाता है और 103 104 भी हो जाता है कभी उसका पसीना भी आता है और खा भी नहीं रहा है कुछ तो अब मैं क्या करूँ मुझे बता ये I was like, so this is what the patient, this thing has captured. So this is, you know, so this probably because my internet connection. So come but task, convert this into soap note. Okay. So like see like, oh sorry. So it says, okay, like, see, it was so, because of internet, अभी भी बुखार में कोई फर्क नहीं आ रहा कुछ भी. So this is like all that you have done is speak in any language that you wanted. And Punjabi and says like a 7-year-old child, diagnosed with typhoid. The mother has been, say child has been diagnosed and like objectively, this typhoid not responded to azithromycin after 5 days assessment. Like and it assessment also gives persistent high grade fever suggests possible antibiotic resistant complication or alternate diagnosis to be ruled out. So it also gives you a plan what is review changing the antibiotic to cefixime or ceftriaxone depending upon the sensitivity, repeat blood culture, like use antibiotics and monitor for complications. So just because you have like recorded this actually has like created, so you don't even need to like create, all you did was listen to the patient and say convert it into a soap routine. I put it in Urdu and it's like at that point of time I said weight of the child is 20 kilos and give paracetamol this thing and it says okay this is the soap note it created. But we all understand that okay azithromycin is not a good drug. So what I did was like as I said I may not know it. I mean I was like okay but we know okay this night. So I put it into the perplexity side okay this is this thing, this is a prescription for a 7-year-old Indian child with enteric fever. Compare it to the latest IAP guidelines for enteric fever treatment. It came back, I have not put it there, बट इट केम बैक एंड सेड कि आपका जो ये है कि ceftriaxone according to this azithromycin is not the first drug that you should be using and say. So I got corrected that probably is not responding because I'm not using the right kind of a medicine and this is something that you could probably be using for this particular thing. Then like अभी ये जो है कि ये there is something called it like when you can say I'll just show you another live example of patient. ये है this is like see this is okay. Hello sir, my this thing, so I don't even need to read it. Okay, I just copy it and I go to my chat gpt. I've created something called a chat custom gpt which you probably would see once we go there. So it's a pediatric consultant and this thing, so I just put it there and use sorry and I push like I just have a sip of cup and it like so I see in a minute it is like patient का नाम नहीं लिखा है but age लिखा है, सब कुछ इसने बना दी, मैंने सिर्फ कॉपी पेस्ट किया. It is give me an assessment a child with an acute cough already on histamine bronchodilator, like it is most likely viral upper respiratory but you have to differential diagnosis. And I would do is like ठीक है इसमें से if I find it like I can say okay something or I can I said like add livolin livolin 0.63 milligram thrice a day as nebulizer. Okay, so then it says okay ठीक है. So now it is given me this thing, so I just have to copy it like here and I paste it exactly in front of you, like, as so it's like, so even the follow up is easy because I just had to, okay, so in front of you I've just written an answer to a patient right in front of you. So you need to create that kind of this thing. So it is important, like I've just covered some of this because it's a very long topic, but you need to take home messages is that AI is your assistant, is not your replacement, but you can use it in OPD or IPD, notes, summaries, patient education, and you can save a lot of your time doing what you were doing manually till now. And the only requisite is that you probably need to learn how to write better prompts, but वो तभी होगा जब आप इसके साथ और खेलोगे, इसके साथ और काम करोगे, तो फिर पता लगेगा. You may not start all the tools that I've just mentioned, but at least one of the tools that you can do. But I would suggest strongly that all of you should buy one pro सब्सक्रिप्शन, बिकॉज फ्री लाइफ में कुछ भी नहीं होता. सो फ्री में जो जो आता है ना, उसका आउटपुट भी अच्छा नहीं होता, तो फिर आपको लगता है कि इट्स नॉट सो गुड. सो यू टेक ए प्रो सब्सक्रिप्शन फॉर वन ऑफ देम, एंड फॉर परप्लेक्सिटी एयरटेल सब्सक्राइबर्स हैव इट free of cost. So I'll stop it here, sir. Like, so if you have any questions, so I can answer them. Dr. Ritu Jain ka question है, which one you prefer? Ma'am, if you're using for academics, say for example, and you want to like search everything, it should be the Perplexity. But if you're using it for routine work, like, the Chat GPT would be better. Like, so depends upon what you're using it for. But I use both of them, like Chat GPT and Perplexity, because to validate whether जो Chat GPT ने बोला वो सही है या गलत है. So we need to see, okay, rather than having one junior doctor, for which many of the bigger consultants think that you probably also you need one person who is very good at computers, so he can do a much better job for you, give you an analysis, give you a synthesis in a matter of few minutes, rather than trying to look at longer duration.
There is another question from a delegate. Sir, what about Indian health AI like GVAI and Carpal AI? Do you have any experience of that?
No, sir, I not use it because these are mainly, I think, these are mainly radiology related, this thing. This is medical AI platform. But as I said, I'm not using, personal kind of, this thing. I'm using it only for doing the Chat GPT and this thing. But there are multiple this things. So if you come to the workshop the other day, you will realize, okay, we'll be talking about how to create your personal avatars for personal branding, how to use AI in academics, AI in research. So there are at least umpteen number of thousands and thousands of AI apps that are available. So from a medical point of view, these are the ones which are commonly used. But there is an organator which is a speech to text kind of this thing. So you need to see what you have to use it for and define your use, and you will probably get you have to do a little bit of a search, and you'll get the right kind of a
Hi, Dr. Pawan. This is Dr. Bhargav.
Sir, नमस्कार sir.
नमस्कार सर. सर एक ही चीज, दो तीन चीजें थी मेरी. एक, एवरीबडी टेंड्स टू हेल्यूसिनेट. तो एक बार आप कुछ भी प्रेजेंटेशन वगैरह बनाए, बोथ चैट जीपीटी टेंड्स टू हेल्यूसिनेट, तो एक बार डेटा जरूर चेक कर लीजिएगा. एक चीज ये हो गई. दूसरी चीज सर, जब भी आप स्कैन कर रहे हैं तो उसको एनोनिमस डालिएगा, क्योंकि इशू क्या है, चैट जीपीटी और परप्लेक्सिटी सारे ओपन एआई सोर्सेज हैं. इससे आपका डेटा शेयर होता है. तो जब भी आप स्कैन कर रहे हैं या कोई इमेज डाल रहे हैं तो वो एनोनिमस होनी चाहिए, उसमें नाम नहीं होना चाहिए.
सर वो है, बट उसके चैट जीपीटी की पॉलिसी में भी है कि दे विल नॉट यूज द नेम फॉर दिस थिंग. सो देयर इज ए सेटिंग में जाके ना एक क्लॉज है, वो कर सकते हो किसी में. तो
बट डॉक्टर वजीर, पर अपने लिए वो प्राइवेसी पॉलिसी में आता है, क्योंकि कल को वी आर ट्रेनिंग द मॉडल्स, बिकॉज व्हाट वी आर डूइंग एट फोर्टिस इज right from a consultation to pre-consultation. So we have an app where voice to text है, जिसमें पेशेंट बाहर बैठ के ओपीडी में अपनी पूरी हिस्ट्री बता देता है, which comes to a dashboard. We see through that dashboard and then we can actually utilize it. Now we are bringing this AWS solution, which we are trying to build up on our own, saying voice to text again, that our conversation with the patient will be captured, will be printed into the text form, and then AI can be put on onto that, from drug to drug interaction to the guidelines that can be done. And the third is the post transplant apps which we have created, which are AI caller, which is helping our patients to have a stickiness to us. So all three things can be actually be utilized in terms of what needs to be done in a AI domain. But the only thing is, if you can develop your own, which is a closed system, and not train with your own models, the Chat GPT or Perplexity or Claude or Grok, that will be appreciable.
I agree, sir. There are two or three Indian who are already doing it. I think एक तो Agnito कर रहा है to voice to text for a couple of years now. Dawn AI is another one which is doing. But I was just saying, because see, those are all paid models, so some people may not really want to pay for every single thing. I completely agree that it should be a closed system, and but I showed the voice to text is possible even with the Chat GPT, that you could we're talking about the child with the typhoid. So this is a model, but AI definitely can be built right in the OPD of this thing. There is a Suno AI, which is like American model, which costs around 10,000 rupees, and you can just put every single details into that text model. So there are plenty which are working on this model, but I'm sure you need to figure out what is best. And I completely agree, and we discussed that whenever you check it from ChatGPT, always validate it in Perplexity, because you would probably need to validate it. Hallucinations is a big problem with ChatGPT.
There is another question from one of the delegates. Sir, is there any variation in results of the search with different prompt phrasing or quality?
एब्सोल्युटली सर, जो हमने बात किया था ना किसी रेजिडेंट का, कि आप रेजिडेंट को क्या प्रॉम्प्ट दोगे कि भाई क्या ढूंढ के लाना है, तो वो वही ढूंढ के लाएगा. सो यू विल नीड टू सी, दो चीज़ें डिटरमिन करती है, द क्वालिटी ऑफ योर प्रॉम्प्ट, लाइक कितनी डिटेल में आपने जैसे उसको बताया कि आपने क्या करना है. आपके लाइक आप बोलो कि मैं शाहरुख खान हूँ, मैं लाइक मैं डॉक्टर वजीर हूँ, लाइक वो उसको वो भी याद रहता है. बट आप बोलो कि लाइक आप बता दें कि मेरे को खाना कब खाना है, तो आप बोलो कि मैं शाहरुख खान हूँ, मेरा वेट इतना है, मेरे को ये डाइट का भी ख्याल रखना है, मेरे को हेल्थ का भी करना है, मेरे को जिम भी जाना है, प्रोटीन भी खाना है. तो जितना ज़्यादा डिटेल जाएगा उतना ज़्यादा प्रॉम्प्ट हर बार आपको डिफरेंट लगेगा. और अगर आपका डीप रिसर्च करोगे तो उसमें भी आएगा. एंड ज़रूरी नहीं है कि एक ही प्रॉम्प्ट आज आप डालोगे और वही प्रॉम्प्ट आप कल डालोगे, यू विल गेट द सेम रिजल्ट, बिकॉज इट इज़ लाइक इट इज़ नॉट ट्रेन्ड दैट आई नीड टू रेप्लिकेट लाइक ए ह्यूमन बीइंग.
Thank you, sir. Any other question from anybody else?
You were talking, I download Chat GPT and try to put some questions. It works well, as you told. Even
Anybody with any other question?
Again, if you have any other question, ask AI.
That's perfect.
ठीक है सर, थैंक यू सो मच.
Okay, sir. Good